Should you treat asymptomatic hyperuricemia for gout? Imagine having high levels of a waste product in your blood but feeling perfectly fine. That's what happens with asymptomatic hyperuricemia. It means your uric acid levels are above normal, but you have no joint pain or signs of gout. Uric acid is a natural byproduct of how your body breaks down purines, which are found in many foods. When uric acid builds up, it can form crystals in joints and tissues, leading to gout, a very painful form of arthritis. But not everyone with high uric acid develops gout. Many people live with elevated levels without ever having symptoms. The big question is whether to treat this condition with medications to lower uric acid. Currently, most medical guidelines say no. Why? Because studies show that only a small percentage of people with high uric acid actually develop gout over time. For example, even with uric acid levels over 9 milligrams per deciliter, only about 20% might have a gout attack within 5 years. Treating everyone with high uric acid would mean giving medication to many who might never get sick, exposing them to possible side effects and unnecessary costs. Major health organizations like the American College of Rheumatology recommend against routine use of urate-lowering therapy for asymptomatic hyperuricemia. The potential risks and side effects of these medications often outweigh the benefits if you have no symptoms. However, there are some exceptions. If uric acid levels are extremely high, such as over 12 or 13 milligrams per deciliter in men or 10 in women, a doctor might consider treatment. But this decision depends on individual factors and should be made with your healthcare provider. It's also wise to look at the underlying causes of high uric acid. Sometimes, conditions like kidney problems, certain medications, or lifestyle factors contribute. Addressing these can help manage uric acid levels naturally. Lifestyle changes are always recommended, regardless of symptoms. These include maintaining a healthy weight, reducing alcohol intake, limiting foods rich in purines like red meat and seafood, and staying well hydrated. These steps can modestly lower uric acid and reduce future risk. In essence, most people with asymptomatic hyperuricemia do not need medication to prevent gout. The focus should be on regular monitoring and healthy habits. If you're worried about your uric acid levels or risk factors, it's best to talk with your healthcare provider. They can help decide if treatment is appropriate based on your overall health and specific circumstances. Remember, high uric acid doesn't automatically mean you will develop gout, and unnecessary treatment could do more harm than good. Staying informed and working closely with your doctor is the best way to keep your health on track.